Professor Thomas, one thing comes to mind that there were disasters in the past also. This disaster is coming at a time when there is an explosion of social media. So there is a good news, bad news, real news, true news, fake news, and misguided information which is coming up. The question comes, how do you deal with this situation? We cannot stop the social media in carrying out its own way of propagating the things. And such kind of disasters like COVID-19 requires what is called as authentic information. So the question comes, what is authentic information? How to filter it out and how to take it to be prepared?
This is an important question because of many reasons. Probably coronavirus infection and its explosion is concurrent with the media explosion, social media explosion, and our young people are more tuned towards social media explosion. But the social media is a basket case. It's a right information, wrong information, opinions, scientific information, non-scientific information. So the challenge is that what is the criteria we use to find out what is the right information. So, and this is very important for our capacity to deal with the situation. And I would even suggest that as part of the university's preparedness, they should have their own channels of communication, to communicate with the students and also to have an exchange of information. Either university create their own channel of communication, somebody should scan and put together that. That's one way to deal with that. And also prepare the students to deal with the right information, wrong information. So one thumb rule is that look at the source of information. You can rely on the source of information mostly coming from United Nations agencies dedicated to health, for example, World Health Organization, and also in the Indian context, Indian Council of Medical Research, government information. So you have to look at what is the source of information, whatever information comes through. The source of information is the important part of it. Whenever you see an information, you check what is the source of information. So I would say that this is the most important aspect of looking at what's the right information, what is the wrong information.
Right.
The second is that coronavirus is a rapidly evolving scenario, and many of our knowledge about this infection is still in its primacy. So it's rapidly evolving. So we need to get information at the very rapid pace as well. So that way, how you communicate the public health information in the case of a public health emergency, a public health epidemic, that's an important skill we should acquire. And university should take a particular skill for the dissemination of information, diffusion of information, and also skill of the university students to differentiate between right information, wrong information.
So the source of the information, particularly from the organizations like World Health Organization, Ministry of Health in Government of India, I think those are the pretty authentic sources which we believe in. And I think what you are suggesting is the faculty should utilize that information to make the students prepared for this.
Right.
I think this is very important because today the youth in a campus are, I won't say addicted to, but are quite dedicated, devoted to the social media, because all their work related to their learning process is through the social media, and hence the bad effects of social media probably need to be filtered out to get the information from the right source. Thank you.
Thank you.